Alberta Health Services wants all Albertans to live the longest and healthiest life possible. Strategic clinical networks will have a direct impact on patient care by leading us in creating the best performing, publicly funded health system in Canada.
There is natural alignment for heart and stroke, and a lot of common conditions affect both. There's a number of natural alliances with respect to different clinical risk factors and research programs. And I think we can, by working together, tackle some of these things. So it seemed like a good fit that we should be linked together within the new Strategic Clinical Network.
The formation of the Cardiovascular Health and Stroke Strategic Clinical Network will improve prevention, treatment, and management for the spectrum of vascular disease. It builds upon the success of three key initiatives: the Alberta Provincial Stroke Strategy and the Alberta Cardiac Access Collaborative, which later evolved to the Cardiac Clinical Network.
So the Alberta Provincial Stroke Strategy was set up in 2005 as a strategy to improve stroke care across the province. We knew that there were major rural urban gaps in the province. In particular, just to give you one example, thrombolytic treatment in 2004 would have been really reserved to Calgary, Edmonton, and Red Deer. That's dramatically changed now. We have effectively 14, 15 centers across the province that can deliver the treatment. So it allows for a much more rapid assessment and treatment of patients. We know time is brain, so that's the large rationale. We lose 1.9 million neurons every minute. So any way we can set up a system where we can minimize delays, it's very important.
Another program continued by the new Strategic Clinical Network is the Heart Failure Optimization Program, which seeks to improve the care of heart failure patients throughout Alberta. It is a 12-step program that looks at a variety of different interventions to help patients when they come into a hospital, during their stay, and then when they are discharged. The goal? Improved communication and access to optimal care with the right doctors and nurses as soon as possible.
I think the Heart Failure Optimization Program has been a tremendous success. Heart failure is a very common disease and will do nothing but get more prevalent as patients and families get older. I think that trying to define the best use of various proven effective therapies for that disease is really very important for the patient, really important for the referring physician, and the interaction between primary care providers, cardiac function clinics, and the specialists really will provide the best care possible.
I think the greatest gains possible in this combined network lie in primary prevention, wellness, and some of the secondary prevention efforts.
We will be looking at the interface between those two diseases, so I can certainly see that we will be looking more at prevention. So the same risk factors that can cause heart attack will cause stroke, and can we do a better job at identifying those risk factors, making people aware of them, looking for warning signs, etc.
There are some very clear strategies that we could be applying to significantly reduce the incidence of both of those, and therefore continue to hold back that tsunami of strokes and heart attacks that are likely as our population ages. We want to see fewer strokes and heart attacks, and we want to see better care in the ones that do occur, and a better recovery for those individuals. And I think that all of those things are more possible if we try to find synergies between heart disease and stroke to be able to do that.